So in the second part of this module, you're going to start learning about specific subfields in psychology, and you're starting with the one that pretty much everybody knows about, and I think most psychology majors think they want to do after they graduate, or at least think that when they get into the major as a first year. And I could actually speak directly to this because I am a clinical psychologist by training. My PhD is in clinical psychology. I did practice during grad school. I specialized in women's issues, particularly eating disorders, but I saw clients with a whole host of issues: depression, anxiety, bipolar disorder, PTSD, and I also worked in a whole host of different settings. So the majority of my training was done in our training clinic on campus, where we mostly saw college students. And I did neuropsychological assessments, as well as personality assessments, as well as therapy while I was there. And then I also worked in several different settings during my placement and my predoctoral internship as well, which is required if you get a PhD or PsyD in clinical or counseling psychology. So I worked doing pre-surgical evaluations for individuals who were going to undergo bariatric surgery. So what used to be called stomach stapling is now called Roux-en-Y gastric bypass, or gastric banding, or gastric sleeve surgery. I also did rounds in hospitals then, seeing clients who came in with psychological or substance-related issues. While I was on my internship year, I did a whole host of things because I worked at what was called a consortium site that had a medical college and 2 campuses of a VA. So in addition to working on the PTSD unit and seeing outpatients at the medical college, I learned to do dialectical behavioral therapy and groups for that. I did a lot of health psych stuff, which we'll talk about in a couple of weeks. So I worked on a spinal cord injury unit, on a blind rehab unit, on a physical rehab unit, in an HIV/AIDS clinic, in a MS clinic, in a breast cancer clinic as well. And also got a little bit of experience working with kids. My specialty is in adult psychopathology, so I don't have that much experience with kiddos. And just a whole host of problems that I saw there for my clients as well. So I have pretty diverse background in terms of clinical experience. I don't currently practice. However, I chose to focus on teaching and research, which are some of the many avenues you can do with a PhD in clinical psychology. If you do want to practice psychology, you know you're just going to want to see clients. What I usually recommend for my students is that you look into master's programs, whether you end up doing a master's in social work or in clinical or counseling psychology. There are routes to licensure from each of those where you could have your own private practice. The vast majority of the time, if you're getting a PhD, you are sort of expected to end up in some sort of academic setting, whether that would be a college professor like myself, or maybe a medical teaching facility, a teaching hospital, in a department of psychiatry, things along those lines. So if you're thinking you ever want to do my job and teach psychology, certainly consider the PhD. But I usually tell people, do the master's first and see if this is really what you like. Also, if you want to do a PhD, you better like research, because that's a big part of what you do, both for what you're paid for, is to help usually with your advisor's research, but also you have to do your own master's thesis and or PhD dissertation. So it's important that you are interested in research enough to do it. I love research and I do it and I involve my students in it. So that's certainly things you could do. But if you don't like research, don't go for the PhD. The other thing to think about with clinical or counseling is just knowing the level of stress that might come along with it. One of the main reasons I don't practice is that I was actually a pretty good therapist in my own opinion, but it was really bad for me to be a therapist. I couldn't compartmentalize well, there's that word. I had a hard time sleeping at night, things along those lines. So it was more mentally healthy for me to pursue another avenue, and I just happened to love teaching. So that was the perfect place for me to go. Now, in terms of ethical issues, these really set the foundation for what we'll talk about the rest of the semester. When you enter into a client-therapist relationship as the client, that client is trusting you with their most valuable secrets. So it is imperative that you do not violate that trust in any way, shape, or form. So your articles and the book and the case studies you'll look at on the discussion boards are really talking about relationships between the therapist and the client. You don't exploit that. And it's very important that you watch what you say so that you don't harm the client rather than help them. So it is a lot of responsibility, not that it's not an amazing job, but this is, again, the field that most, I think, psychology students think they want to go into, but read about it and see, because some people discover that's not what they want to go into. And we've got a whole bunch more chapters and modules we're going to cover of all the different subfields that are possibilities and all the different jobs you could go into. And I mean, you have so many possibilities even within clinical and counseling, which your careers book does a really good job outlining, I think. So I hope that you enjoy learning more about these subfields that everyone kind of thinks those are all psychology is. It's obviously so much more than that, but this is a nice place to start because of that reason.